Yeah.
Okay, so I'm gonna disappear from the camera. Bye.
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 Hi, everyone.
Good afternoon.
So we're taking 2-3 more minutes just for people to join, to set up everything. And so thank you for being patient.
You have such a nice boost background. We
Oh,
know
you like
immediately who will be talking later. Very
Yes.
nice.
We're all branded by the project.
Yes, nicely branded. Irena, where are you based?
Based in Belgrade, Serbia.
Belgrade. Oh, yeah.
Yes.
I was there last year for holidays and
Oh,
visiting
really?
friends. Yeah. Did little tour around the Balkan countries. Very, very, very nice.
So let's have 2 more minutes because I still see people joining. And then we're going to start. How everybody's feeling? Afternoon? Good. Great. Muted. So I think we can slowly start, and I guess people will join. Hello once again, who wasn't with us last Wednesday at 4 Central European Time. My name is Irena Molnar, and I'm coordinating the training sessions within the Boost project. As you might know, these training sessions, digital competencies and digital services tools are happening within the Boost project that is funded by European Union. And I'm also, and the Boost project is also a collaborative project of several networks within Europe. So welcome once again, and I hope that this session will be interested as the previous one. So we're going to be together for 2.5 hours. And first hour, we're going to have one part of the session, and then we're going to have a break, which will be half an hour, and then we're going to have 50 minutes of presentation, questions and answers, and evaluation at the end. So it will be similar. Each of the 4 sessions will be pretty much similar. So this is some programming that we did for people to get used to, or not change a lot the time flow or sessions between them. So today I have a pleasure to host Stefan Pejić and Nina Šašić from NGO ReGeneration. And we are going to have one guest today, which is Lella Cosmaro, who is going to speak about the experience of planning and management from her organization. It will not be the same as previous. So the focus of discussion will shift towards planning of the digital services, implementation of the services. It will go through monitoring of the services and evaluation. So we will go a little bit hands-on on how actually services are being planned and what to consider when you're designing one in your organization. It can also give you a little bit more information in depth about what are the things you need to think before you start planning. So including everything, not only the digital tools that you might use, but also the team, the people, the funds, the resources, different types of resources that you can use. So this session will also be recorded, so it will be available online afterwards. And I'm also will share in the comments now presentations we're going to have now translated in Russian, but I'm urging everybody who comes from the Russian speaking languages and have struggled to follow up our English to ask or write directly in chat or to Alexei Lachov, our colleague from Your Input, who is there to support us with Russian as well. Not to take any longer time, I'm going to welcome Stefan Pejić, and please, Stefan, start the presentation. And of course, if you do have any questions during the presentation, please write in chat or write us directly. We're going to make sure to answer everything that it's possible within the sessions. Thank you.
Thank you so much, Irena. So I'm not gonna take a lot of time for this. I'm just gonna go straight to the presentation, which hopefully you can see now fully.
Yes, we can.
Yep. Okay, great. Hello, everyone, once again from me. I'm Stefan, and for today's first part of this session, we're going to be focusing on digital services, what they are, how to set them up, and I will be talking from the perspective of our organization and how we actually set these services up. So I will be talking more or less about the anonymous services on digital platforms. But as Irena said, we will have Lella that will be talking a little bit more about the services that can't be anonymous. So when it comes to digital services and what those are, the very short way to explain those is the electronic delivery of information across multiple online platforms, devices, and delivery mechanisms like web or mobile. If at any point I start talking too fast, please let me know, because I know this happens quite often. So just let me know and I will slow down a little bit. One thing I want to make sure we all understand in the beginning is the availability and accessibility of digital services. Of course, not everyone can access these, and that's something we have to have in mind. But the thing about them is to always keep the pros and the cons in your mind. So yeah, one of the cons is that not everyone will be able to access them because they don't have access to either the internet or the necessary technical stuff they need, like computers, laptops, phones, whatever. But the thing is, they are broadly available. And of course, no service will be absolutely accessible to everyone. And when we are talking about digital services, we never say that these are the only ones that should exist. They are able to help us bridge the gap, different gaps, but mostly the ones that are considered either, well, people can't access some service because it's not available in their city, or either because they don't even know it exists or whatever. So when we're talking about these, it's not necessarily only about doing a certain service like counseling, but also giving people information about different services that exist and how they could access them. So when we're talking about the phases and the process of setting up the digital services, it's not that different from setting up any other service. So we can roughly split them into preparation, planning and management, and evaluation. And today I will be mostly talking about the preparation of this process. So one of the things that we always start with is a needs assessment of a source. So we have to know our community, what are their needs, what are the issues that they are facing, what are some of their behavioral patterns that maybe put them at risk or could be of help for us to reach them better, what are some of their norms and values, and in the digital world, what are the platforms they use. When we started thinking about setting up digital services, as we are mostly focused on youth, we kind of had an idea of where to start. But as our practice has showed us, your idea may not necessarily be the same as the one from your community, but we will be talking a little bit more about that in some of the next slides. One of the things when it comes to different platforms is that we really have a lot of different options, which I won't dive into that today a lot because Alexei next week will be talking a little bit more about different tools that we can use. But some of the things to keep in mind for today are different chatbots, anonymous Q&As, encrypted messaging and broadcast channels, different online community platforms, video conferencing, different apps and social media. And when we're talking about these, depending on the community you work with, those could also be dating apps. So some of the organizations working in the field of prevention of HIV or working closely with the MSM community very often use, for example, Grindr, which is a dating application for men, to actually share the information or offer the services. We as an organization are mostly focused on harm reduction and recreational drug use, and those were actually the things that we were focused on, especially when we started doing the online peer counseling, which pretty much was really easy for us when it came to thinking about it and thinking about how to set it up. But when it comes to implementation, there are a lot of things that can happen, which we will dive into a little bit later. But how do you choose the correct platform is the probably biggest question. And there is probably not one right answer, but many of them. But this is something to keep in mind when you are choosing the platform that you will be using for your services. In the first thing that you should keep in mind is the needs of your community and also the things and the platforms they are using. Also your resources, for example, does the platform or the tool you plan on using, is it free or is it like subscription based? Do you have the funding for it? And also the skill set of your team. Like, are there any platforms they're more comfortable with using than others? One of the dialogues that we had was, okay, we could possibly do this on Discord because we know an organization that is doing this type of things on that platform. And we're like, okay, that might be a thing, but we're not sure that our community is on Discord, first thing, which is easy to find out via the needs assessment, but we weren't skilled or even like basically informed about how Discord is functioning and what we could or shouldn't do on that platform. So we had to find a different source. But the best platform for you is probably the one that both you and your community and your team are familiar with, that is accessible as possible, and available for the broadest audience possible. So what are the things that you should keep in mind? Like, do they have to be subscribed there? So do they have to pay for the platform? Do you have to? Do they have to have an open profile on that application? Do they have to register in a way? These are all the things that you'll probably be going back and forth when planning the service in the digital world. But going back to your team, like, who do you even need? Where do you start? What are the roles? What should be their skills? And I know that when we are talking about the digital world, things can sometimes feel really scary, but it's really not that different, or doesn't have to be that different from the services that you offer in person. So pretty much you would need someone who is responsible for the team and that things are running smoothly. So pretty much a manager. And if you're doing like outreach services, this is pretty much outreach in the digital world. And you would also need, of course, people who will be doing the service. And that really depends on the type that you're doing. But in our case, those were the peer counselors. So we've had people in our team that were trained on how to deliver information and what generally is the main idea of our service. So when we started, we asked our community that was mostly on Instagram, because like I said, we do work with youth, and we're like, okay, if we were to set up some kind of digital service, what would you guys need? So that's how we came to counseling as the main thing. But there were also some answers that pointed out that they would need some kind of quick Q&A sessions where they could just ask a really short question to which we would respond. And one of the things we used was the anonymous Q&A app, which they don't need to download. They just have a really neat link. They ask their question, and we actually shared their questions and our answers publicly, so we could actually inform also a broader audience about those. But the information that we were giving out was the harm reduction, where and how they could get tested for different STIs or HIV, some things about prevention and reaction to the violence, safety in nightlife environments and stuff like that. So it was really important for us to kind of gather their questions and do some kinds of like posts where we could share the information. So we were answering questions directly, but we were also doing the so-called themed posts. So one week we would share about the VCCT, the other week we would share about the safer nightlife environment and stuff like that. So these are all the things that you can kind of keep in mind when thinking about even developing some kind of digital service. So, of course, one of the first things where we start, and it is our rule book, it's where everything is, and it was very important for us to set this up in the beginning, so everyone knows how to proceed, and because we had different people on our team, we kind of had a standardized service offered. So the first step would be to create a really comprehensive protocol in which you would cover both theoretical and practical aspects of service provision, and keeping in mind all of the things that could possibly happen. So one of the talks that we've had was, okay, what if someone is coming with a question that we're not comfortable answering? What if we don't know the answer to that question? What if the situation really escalates or the person is really unwell? How do we act in those situations that we luckily didn't have, but we really had to think in advance, so we wouldn't have to like act right there on the spot, but we would have the protocol behind us that we know, and we would act accordingly. So when it comes to the protocol, this is really the first step, and literally you don't do anything without knowing exactly what it is. The whole team should be included when making this, and they should like really know it like word for word. We only start implementing our service when we have the protocol and the referral system in place. And these are the things that might seem a little bit out there, but we will get into the details. So a good protocol always includes a referral system, because there is no way you will be able to fulfill all your beneficiaries' needs, answer all of the questions they have, or offer every service they might possibly need. So one of the things you should think beforehand is, who would you refer them to if you're not able to actually do the service yourself? You need to plan the service in advance, step by step, once you know which channels and platforms you will use and all of the other details. What does this mean? Well, when we say the protocol should be step-by-step plan. It's literally that. So the service that we were offering were online peer-to-peer counseling in the video conferencing program. So we were like, okay, this has to be anonymous. And at that time, we chose Zoom because still it was somewhat anonymous. They don't have to make the profile. We're like, like right now we're all registered with our names, but there is actually a way for you to make a meeting. They can join just via the passcode, and they don't have to log in their Zoom account. So it's totally open for that. And we're like, okay, that solves it. But what happens when there are a lot of people there? Because we were doing it one-on-one. So we were really keen on informing people that there might be a possibility that they will be in the waiting room. But we've had like the pre-typed message, like, we're in a session right now. Thank you so much for your patience. We will let you in as soon as we finish with our client. And those were all of the things that were in the protocol. When we were doing the counseling, the protocol is always open in another tab, as well as the referral system. So it's really easy for us to copy and paste things. Okay, so you're in a session. There are the first few informations that you should give to people, like, hey, this is anonymous. We don't need your name. You don't have to turn on your camera, your microphone, whatever. We can just use the chat. If you want, I can talk. I can also type, depending on where you are, or if you're in a situation that you can listen to me, or it would be more convenient for you to just chat. Our cameras as peer supporters or whatever, peer workers, were always on. So they knew exactly who they were talking to. And on that day and a few days before, we would also inform everyone who would be offering the service. So when Nina was doing it, there were a lot of girls that were interested in different topics that they were more comfortable talking to her about than to me about. But on the other hand, there were a lot of guys that were interested in different things about testing for HIV or STIs or safer chemsex that they were coming to me to. So that's why you should also, when making your team, count those things in and really be open about what they can expect from your team. So there is a question, but Irena, can you please just send me the question so I don't exit this and I will answer it. There
Sure,
are
I
some
already answered this question, will be answered later, but you can also address it at the end. It's fine.
Okay. In some situations, there were some information that we had to ask ask our clients, but just in order for us to give a more specific information. So when they were inquiring about where they could go and get like VCCT, we're like, okay, there are different options in different cities, and we can send you the links to those. But if you are okay with like sharing where you're from, we can also give you a more specific information about different, whether they're NGOs or the government institutions. So you are in a session, you are answering the questions, whatever question they have. But also one thing to keep in mind is how you are talking to clients, what is the information you are giving to them. And Nina will be talking a little bit more about that in the implementation part of today's training. But those are also the things that you should put in your protocol. And of course, one of the things you should set up in the beginning is the monitoring and evaluation part, because those are always done throughout the whole service provision scope. So you want to really put them in the front right away. We had those prepared, and when it's kind of like getting near the end of the session, we would just send them the link with like, hey, we just want to have some feedback from you. Like, was the information that you gained useful? How would you rate this? Would you recommend it to a friend or whatever? So here you can see a little bit more about what the protocol actually consists of. So you would have information on data collection, like how is the data collected? What type of data? How would you process it? How would you keep it safe? In our situation, we weren't collecting data. We didn't need their emails. We didn't need any kind of contact or the name or whatever. And we did have like the small notes for us, but those were, as Nina will show you, anonymized in a way that it's just the necessary information for us that we have to have. Ethical and communication principles, proceedings in case of unforeseen or emergency situations. Those are the things that you really need to think about and like have some time in your team to really try to go through all of those things. But also you should make templates for reporting or evaluation communication ready. So everybody in your team knows exactly which information they should put in or which information they should like pay attention to. What are some of the indicators for measuring your success? And of course, different templates when it comes to those topics. And of course, the referral system for other services. Like I said, we were mostly focused on harm reduction and safety. And we don't offer services like testing or legal support, medical support. We do have people that we work with and that we refer them to, but these were mostly project-based, so they're not, we don't have a person whose job is just that. So they could all at any time work with the client. But some of the people that we were working with wanted to know a little bit more about where they could get some legal aid. For example, they have experienced, we've had a few cases where people experienced some kind of issues at the doctor's office, whether it was because of their HIV status or because they were part of some minority, but they wanted to know a little bit more about what they could do and how to actually respond to that. When it comes to like violence, we've seen that people, at least here in Serbia, don't really know what like gender-based violence is or how it really looks like, and all the different nuances that it comes in. So you would always try to, when giving out information, of course, answer their question, but use that as the opportunity to give them some more information, or to just help them or encourage them to make some steps or whatever. One of the things we've had pretty young male that needed some help with the doctor's appointment, but was really scared of going to the psychiatrist, to be concrete. And we actually offered to go with him and go through all of that, because he wasn't from Serbia, he wasn't speaking Serbian, so he needed someone that he could trust to help with translation, but also explain a little bit more to him about like what are the steps that he would be going through and stuff like that. Those are the things that you can't really plan out, but you can try to do a full scope of services. If we knew that there is some NGO offering free legal advice, or some, I don't know, direct contacts for government institutions or stuff like that, we would refer them to them. But also all of the organizations and institutions that we were referring our clients to were the ones that we were working closely with, and we've had this kind of cooperation. So when people would, for example, go to test for an STI or HIV, and mention something about chemsex, that organization would also refer them to us and be like, okay, if you need any help with that, or just learn how you can do it more safely, you can get in touch with ReGeneration, and they would be able to help you with those. When it comes to protocol, it is really important for you to define your approach. So what are the basic principles to guide your team's attitudes and communication? So how they're communicating with the clients, but also what is and what isn't their job. So for example, like when we were working with, when our colleague was actually in one of the sessions, she was texting us like, apparently I have this really creepy guy that's asking me questions I'm not really comfortable asking, and he's not here to get any information, but just to do whatever he was doing. We're like, yeah, but you can always take a break and say goodbye, thank you, this is not what we are for here. So just for your team to keep in mind that they shouldn't put up with anything that they're not comfortable with. Logistics, what is the space and time, what is the audience you're working with, what are the information you are offering. And when it comes to space, right now we are talking about digital space, but what are the platforms you are using, when and why? Are you doing it like in your working hours, so from 9 to 5, or would you have some different designated times? So when we started doing these services, we were like, okay, let's try it like from 10 a.m. till 1 p.m. and then try it from like 6 p.m. till 9 p.m. and stuff like that. So we were trying different things, constantly communicating with our target audience to see what would be best for them. Of course, protocols and proceedings, rules of conduct and ethical code. Ethics and rules. I know it's not the most fun part for the people, but especially when we are working with marginalized people, and I guess a lot of us do, these are the things that are really important because you never want to do any harm. Management, monitoring, and evaluation always go together. So you should plan them out beforehand, just so you know how things will be going and that you can actually measure them. And all of these things, like you have step 1, step 2, step 3, but in reality, you would be going from like step 1 to step 3 to step 2, back to step 1, go to step 4. So seriously take a lot of time to prepare the protocol, and also be prepared to change it once you start with the implementation. And during the course of almost a year of our digital services, I think we've updated our protocol like 3 or 4 times because there were different needs, or there were some new services available, or some of the services that were available when we started closed. So you should always keep it updated. Of course, when making the referral system, you will always have some kind of idea what your beneficiaries will most likely need. So you should probably put it in like one place. Also, you do this before you start the implementation. But for us, this is how we made the referral system. So we kind of did 6 basic questions in a spreadsheet. So one sheet would be, for example, VCCP. So what organization or institution is offering the services? What are the services they offer? What are their working hours? Where are they? Are they in Belgrade, in Novi Sad? Are they doing outreach? Are they doing any online services? How would the person access them? And what are the populations they work with? Those were the kind of questions that we've had in mind. So in that sheet, for example, BCCP, we would have 6 or 7 organizations. Client, we would refer them to 4 of those if they were, for example, from Belgrade, because that is the capital of Serbia and we had the most services here. I would actually go to questions right now because we have just a few minutes for those. But I can also stop the share so we can actually see each other.
Do you want me to read the question?
We can do that, but I can also open the chat if it's in the chat, I guess.
So the question is, you mentioned public Q&A where users don't have to register. In your organization experience, how does it work when users have to register and provide some personal details? Is it abstaining them from using your digital service? Maybe useful will be to explain them how we do Q&A that is totally anonymous, and also explain them what if they need to give us some personal info.
Yeah. So in our case, we've had a lot of people answering the questions or asking questions, because sometimes we would like, okay, let's switch it up and let's ask people like what is safety for them, to see how they're thinking, to see what information maybe we could offer. And we would have a lot of questions in the Q&As. The people that were coming to the counseling were the ones that really had like specific issues or really needed someone to talk to directly. When we needed some personal information, we've always had it in the protocol, like what is the information needed, how it is had, with whom it is shared, just in case that whatever, no problem arises, or we don't kind of ruin the safety of our client. When we were referring people to some services that they would need to give some of their personal information to, we would always tell them, like, this is the information they will ask from you. This is why they would need it. And that was pretty much it. But I have to say that people are more likely to join something if it's really easy and anonymous, and will be free to share a lot more personal stuff face, or their
Can you repeat your last sentence? Because I don't I think we lost you a little bit.
the thing that we used.
Can you hear
That was
us?
the only question, right?
Yeah, I also asked you to repeat the last sentence because we lost you a little bit in the internet might be down or something, so we lost you in explaining just the last sentence.
Okay, yeah. So people are more likely to share more details with you if it is anonymous, and you can actually get more information out of them, so you could offer a better service. So whenever we were needing any kind of information or asking follow-up questions, it wasn't because we wanted to know who we're talking about, but we wanted to know how to offer the best, most reliable information that we've had in that moment.
Yeah, so that was the only question. But I think maybe it's important to note that this is only ReGeneration's experience. And also the thing is that our community needed this service. So how we came to be completely anonymous is because we were doing pre-evaluation and collecting data on what they actually need. So it doesn't necessarily mean that community that you are working will be in need of that service, but Lella afterwards and Nina are going to tell more about the services that are not anonymous and also how they deal with collecting data and what it actually means. In the fourth session that we're going to have within this training, Adria is going to speak about the ethics and data protocols and also safety. So this will also be something that will give you like the overall information about what is out there and what are the, how to say, different examples of how things can work for you. So you can pick what is more suitable for you, but also you can choose what is more suitable for your community. So it's also very, how to say, it should be very community related. And I think that maybe what Stefan's presentation was intended to give you is the step-by-step on how you do the planning. It not necessarily means that your plans of your digital services will be exactly the same. It can be adjusted towards your needs or your skills or your resources as well, but also it can give you idea on what is the overall goal of the service and what is everything that you need to have in order for everything to run smoothly. Not necessarily for us run smoothly all the time, but this is where we came up after 2 years of delivering counseling services online. So is there any more questions that we can answer right now? You can be free to ask them. I also want to ask one more question for the people to, for Stefan, for the people to get more familiar with the things, how we did. So when we say publicly Q&A, can you explain a little bit more about the outreach of services that we did? And maybe a little bit more about geographical coverage of the service? Because for us, it was the full state or the full country, so not really the city we're based in. So maybe can you give us the 3 minutes of that? Thanks.
Yeah, of course. Yeah, we were focused on Serbia, but I have to say that we've had some clients that weren't even based in Serbia, but were speaking the same language. So wanted to know a little bit more about if we know something that's available in their country. But going back to the anonymous Q&A, as I said in the beginning, our primary platform with communicating with our community is Instagram. So everything we were doing was through Instagram stories, which are not anonymous, but using the NGL application that Irena sends to the chat to link to. So you register. So for example, we've made ReGeneration's account there, and you get a really short link that we use to share on our stories. So people, when they click to that link, they can send any amount of questions that are completely anonymous, at least for us. So you can share it, and actually you share their question and you type in your answer beneath it directly on the Instagram story. That was something that our team was comfortable with, our community knew very well, and this is something that worked like magic for us. We would share the link on the day before and the day of the counseling. So anyone not being able to join for whatever reason, they would get a chance to ask their question there. So we would really get a lot of questions. So for example, we would get 15 to 20 questions in the anonymous Q&A, but 5 or 6 people would join the counseling. So yeah.
Yeah, so I also use the chat to send you the link from the Q&A sessions that we had. And in the Q&A sessions that we had, how it looks like to deliver an answer. So you can see, if you can see it, you can see that the question is completely anonymous. And we are then able to explain and give answer to the questions that we are asked. So in that sense, I know it's in Serbian, but it can give you a sense of how it looks like for public, or I mean for the general public to see, because this is completely available. And we, how to say, it was for many people it was tricky to ask the questions, specifically the questions who are maybe sensitive in a way. But then when we were posting the answers, we received many more answers to that story saying, yes, this is also what I wanted to ask, or this was very helpful, thank you. Or so, I mean, only one anonymous question can also give you the space for the community to give them as much answers and receive many feedbacks that you previously did not anticipate it. So I think that, I mean, this works for our community, not necessarily this works for your communities. I mean, this is, I cannot stress it enough, but also I think that when you try to do a service in the online space, being that the counseling or being that in different platforms such as, I don't know, Telegram or chatbots or anything else, and you anonymize it to deliver answers to broader community, it can also give you very nice feedback to what community actually needs. But just like the one step into it can bring you much more. Based on that, you can also plan further the service or delivery or the referral protocol or promotion of any other service that maybe you are not doing but somebody else is doing, which also I think it's important. I know that the communities that we work with, they do not follow all of the communities, all of the services out there, but also, and they do not know as much information that we know as service delivery persons. But I think that only delivering specific info can also bring community a little bit closer to you, and also works in the building of the trust between you and your service people who you serve to. So in that sense, also all this data and all this information can also work as a trust builders between you, and also increase the community you work with, because for ReGeneration that was the case.
yep, it was literally like a domino effect. So one question or one answer would really start, and you could really get into like direct communication with the community. But I think it's important for you to understand that this didn't happen overnight, as it might seem from my presentations or the way we just spoke. Like these were a lot of trial and errors. And when it comes to at least social media, you have this great thing called the algorithm. So it was really important for us to even find out which exact time we should post, because sometimes like only 50 people see it, sometimes 500 people see it. So those are all the things that you kind of try and see what works. I did talk about how and what we did, but it was just to kind of give you an idea of how it looked like for us. But of course, I imagine things would be different for you, and that is why the first step is always the needs assessment. So yeah.
So Janko had a question on the Brave app, and it says, is there any possibility to import to Europe the Brave application? It's used in United States, I think, and also I'm not sure about Canada, but I know that it is implemented there. For those who not know or not familiar with the app, it helps with the prevention of overdoses by monitoring clients by digital means. So I'm not sure if we can do that. I think definitely it's worth exploring how it's possible to do it, because it also has things related to geolocation and stuff like that. So we currently do not have that possibility here, but I'm definitely going to take this question to our expert board and also some people who are in the digital team within this project, so we can make sure at least to give you an answer how we can do it, or is there any possibility to make a collaboration. I'm sure, Janko, that we will need also to secure funding for something like that, but I am sure that this type of an app could be, if not imported into Europe based on what they did there, maybe it's something to explore in building such possibilities further in Europe. I'm not sure if I gave you an answer because we don't really know this, but I think it's definitely worth exploring within this process or within this project. We can definitely approach them. I can even link you the app so you can see what it is. So I think we are overdose detection app. I'm going to link you the app here so you can check what it is about. But yeah, like Janko said, it's not available in Europe, but this is also something that is a very nice tool and also very good service. So I think it's 5 o'clock now, Central European time, for those who are not in this time zone. This is the time that we go for a break, and it will be a half an hour break. After that, we're going to return to the session with Nina Šašić and Lella Cosmaro again to speak a little bit more about concrete implementation. They will give you some examples on protocols and very nice and useful stuff. I also want to remind you that all of this that you're hearing right now will be also online in a link, but the sessions are going to be transferred into Manual, and Manual will also have detailed information, plans and protocols you could use and adjust, and also templates for things that you heard during these 4 sessions. And I guess it will be a very nice comprehensive information that you can use as a guide for building your future services. So you don't have to leave the Zoom. We're going to be here. You can just cancel your cameras and your microphones, and we see each other in half an hour. And thank you, Roberto, for recording this. So thank you for being with us this afternoon. And I think If everybody's ready, we can continue with the session. I advise everybody to check in the chats because they're very nice apps linked there, so it might be useful for your future work or information. This is also something that we're going to make sure to have in the resource package. And I think if you have any more ideas or anything that we previously asked you in the email, or we will ask you in the email, if you know any other digital service or digital tool that is available in your language or in your local community, in your country, please send us that via email or within the evaluation, because it will be very useful to gather also tools and resources to overcome the language barriers, because we did collect within our teams such an info, but we do not speak all of the languages that are out there. So it will be very useful to offer as a wide information that we can. So this continuation of the setting will be mostly about the managing, monitoring, and evaluation of the services. And we'll also cover part that I think Ada was asking. Yes, Ada was asking about delivering the services that are not anonymous. So I think we will have around 45 minutes of this term, and then we're going to go to questions and answers. Of course, you can ask your questions in the chat during the presentation if something is not clear, and also you will be able to ask questions within the evaluation. Please keep in mind to stay, if you can, up until the end, when we're going to deliver, to send you the link for the evaluation. But be assured that we're going to send also the follow-up email with the links for registration to the next session, and also for the evaluation if you didn't do it today. Thank you once again, and yeah, I wish you a nice session. Nina, Lella, stage is yours.
Hello, everyone. I am Nina Šašić, for those who don't know me, and I will now just share my screen so that you can see my presentation. Okay. Just a moment. Sorry. Can everyone see my presentation now? I just need a quick confirmation.
Very well. Yes.
Okay, thank you. So yes, this continuation of the session is going to be about the management, monitoring, and evaluation of digital services. It will build on what Stefan has told you. But first things first, when, why, and how do we actually manage digital services? The first question is the easiest one to answer, actually. The activity of managing digital services takes place over the entire course of service implementation, which does make sense, right? It stands to reason that as long as the service is being provided, the management of this service also is taking place. It is important to manage digital services, and for this management to actually be very proactive, because it does include the process of monitoring, which you can think of as essentially keeping tabs on the process of service provision, right? In order to prevent, or if not prevent, then minimize any complications or any issues that arise. Management of digital services also does help us make slight necessary changes or react in a timely manner to any issues, but there will be more on this later in the presentation. But when we are talking about the management of digital services, we need to understand that it entails, on the one hand, collecting and recording data on service provision, mostly through reports, and also its progression, efficiency, any data actually that we can collect regarding the process of service provision. It also entails ensuring that the course of service provision is as smooth and as uncomplicated as possible. Obviously, there may be issues, as we will talk about later. But this is the general idea. And also, it does entail making alterations or adjustments along the way, but also only if needed. The first thing I wanted to draw your attention to is the management of the general approach and some basic communication principles, as Stefan has already described in his part of this session. These principles should be outlined in the protocol itself. Sometimes this part of service provision can be overlooked because it's maybe not as technical or maybe not as concrete as other aspects of service provision, such as deciding on timetables, managing your team or something like that. But it is important to note that there should be some basic communication principles making up the overall approach of your service provision, right? And here I have just singled out some basic principles which I think should be included, which first of all, we did include from our own experience in our service provision and the design of our services, and also which I think should be always included in the protocol and in digital service management, particularly when working with marginalized populations, as I think everyone probably in this training is to an extent. So the first principle would be a non-judgmental approach. This entails reserving or not expressing value judgments, if at all possible, which it is possible, and not stigmatizing your beneficiaries' either identities or lifestyles. And it is very important to explicitly say this. I know that most probably your team will consist of people who are sensitized to working with specific marginalized populations, but they should also be able to school their reactions, because sometimes, particularly when we're talking about services which are anonymous, sometimes a beneficiary may say something that may provoke some kind of negative emotion, but team members absolutely have to school their reactions and avoid any kind of judgment or stigmatization. The next principle is respecting the beneficiary's privacy. This mostly refers, and this is from our own experience, which, as Stefan has mentioned, and also Irena, and also I, were services which were provided anonymously. Respecting beneficiaries in be beneficial.
Nina, can I ask
Yeah?
you to repeat the slide because we lost you due to internet, I think?
Repeat the slide or just, oh, okay, the entire
The last
thing?
sentence, yeah, because we lost you
Okay.
for a second.
Okay, can you hear me now? Okay.
Yeah.
Okay, so the second principle here is about respecting beneficiaries' privacy, which mostly relates to not asking for any personal information outside of what you absolutely need in order to perform or actually provide the service for the beneficiary. And if you do think that asking for some additional information could be beneficial for the process of service provision, for example, I think Stefan mentioned this in his first, in the first part of the session. Sometimes, due to the process of referral, we may benefit from some additional data, from some additional information about this beneficiary. But if they are not comfortable with sharing this data, and they may very well not be comfortable with that, we should not insist on that. And we should not frame it as though service provision or the quality of service provision hinges on them providing providing this additional data. So this is what respecting their privacy essentially means, what we mean when we say this. The next principle is adhering to etiquette. Basically, there should be some rules of conduct which should be agreed upon at the start of service provision. Some of these rules can be more general, for example, respecting the beneficiary's pronouns and using the pronouns they use for themselves. But also some of this etiquette actually relates to letting the beneficiary take the lead on the exact channels of communication, and also taking their cues in terms of the tone of communication. What does this mean? For example, when we were providing our one-on-one consultation type services, these services were provided through a video conference platform, and there was obviously the option of the beneficiary using their camera, or if they're not comfortable with that, just using their microphone and not their camera. Also, there was the possibility of them not using either and just conducting the entire communication through chat. This should always be left up to the beneficiary, and we should respect this etiquette, these rules of conduct and rules of communication, which we established at the beginning of every session. For example, maybe the beneficiary is not even comfortable with the service provider using their camera or microphone. Some beneficiaries just want to have the entire communication take place in the chat. The next principle refers to encouraging a positive outlook, meaning that we should acknowledge, praise any positive changes the beneficiary is making in their life or way of thinking or behavior, and we should absolutely acknowledge that and try to build on that instead of insisting on drastic changes straight away. We should encourage this positive outlook. Okay, the process has started. It's very good that you have started. Doesn't matter if these are just relatively minor changes, something that can be thought of as baby steps. So we should try to be positive about this and try to foster the idea of this sort of gradual transition towards healthier or safer choices. And the last one, but not least important, is to communicate. Very, very important. What we mean by communication let them set the tone and respond to it. But also, we should strive to communicate as clearly and as efficiently as possible. But also, communicating responsibly here in my presentation refers to absolutely not.
So I think that we lost her completely, but I'm sure that we're going to figure out how to get her back.
Yes, apparently. Am I here now?
Yeah, we can hear you now. Yes.
Okay, can you just tell me what's the last part that you heard? I'm sorry, I don't know what happened.
Communication.
Okay, so it wasn't too much time lost. Okay, so yes, I was talking about the necessity to communicate both clearly and responsibly. The clarity of communication, I don't know how much of this you have heard, so I'll try to make it shorter. The clarity of communication here in our experience refers to not using overly formal language, not using too much medicalized language, not using too much slang. So yes, we should let the beneficiary take sort of set the tone of the communication, and we should take cues from them, but we should always strive for very clear and very efficient communication. And also, this is maybe the most important thing, communicating responsibly. This refers to never, absolutely never offering unverified information. So over the course of our provision of digital services, it has happened, that's always a possibility, that someone either says, the beneficiary either says something that you do not completely understand, or they are asking you something that you don't know, you yourself. Maybe you think someone in your team has more experience with this particular matter, or maybe they are just asking you something that is not within the scope of your services. This also happens, unfortunately. Yes, you do communicate to the target community what the services are, but and what the topics are, but still it may happen that someone will ask you something that is not within this scope. There are a lot of things you can do if you think that first off, if you don't understand entirely what the beneficiary is saying or asking, you do not answer just off the top of your head based on what you think you understood. You try to ask for clarification very gently. You try to ascertain if you are understanding correctly what they mean or what they are asking. And if they are asking something that you do not have the answer to, just do not offer unverified information. This is something we go over with our team anytime we provide the service. You can either, if you think there's someone from your team who is better equipped to answer this question, you can see if it's okay for you to refer the beneficiary to another team member. But if and this is more often the case, if they're asking something that is not within the scope of your service, there is always another service that you can refer them to. And this is really where the referral system really comes into play, because you will be referring them to other services. A moment. Can I? Yes. Okay. When it comes to managing your team, it's very important to make sure that your team is familiar with the rules and proceedings. So this is what Stefan was saying earlier, that it's important, if at all possible, that your team, the whole team, is included in protocol creation. So you have to make sure that they are all familiar with what is expected of them. Also, that there is a clear understanding of what everyone's role is, what is expected of them in terms of service provision, but also in terms of reporting on services, and the conduct, obviously, that is expected of them. And also, you have to make sure that there is a clear chain of command. So when and if something unforeseen happens, they need to know to whom they, basically who they turn to, right? In which case. And now, for maybe the most complex part of service management, alterations and tweaks. The first thing to understand is that we need to know when we have to make a change. So the thing is, no matter how well you create your protocol, how thoroughly, how detailed you make it, you will always find room for improvement, right? You will always see, when you start implementing the service, you will always see some minor details, some small bugs, which you will file away for later, and you will say, okay, this can be improved on. The trick is that you need to know what to change. Not everything, not every, let's say, flaw in your service design warrants immediate tackling. It's very important to know what to change, because when you are making changes mid-service, this is always dangerous to some extent. And it's important and it's good to have a system in place in advance, so outlined in the protocol, that helps you know when and how you can actually make these changes. you have to take into consideration or to keep in mind that these tweaks need to be very minor and they need to be performed very smoothly, because otherwise they will actually compromise the quality of the service. Okay, so when you are deciding if you have to make the change, the first step is thinking about it, thinking if the problem you found actually compromises the service or significantly affects the quality or outcome of the service. If it does not, then any fault you found can be filed away for later for evaluation. If, in fact, you decide that there have to be adjustments mid-service, you need to carefully plan out this change, because you need to make the change as minor as possible while still having the benefit of the effect that you need to have. So you need to try to find a way to improve the service as much as possible with as few changes or as minor changes as possible. And it's also very important to plan out the introduction of this change. So even if you decide, yes, I need to make a change, and this is what the change has to look like, you have to keep in mind the process of gradual introduction of this change, or maybe not the gradual introduction of this change, but timely communication of this change, for example, to target audiences. This is very important, especially when you're making changes that affect the logistics of this service you're providing. For example, if you have to change timetables midway, either because there is an external factor that makes you do this, or because you found that the timetables you designed in advance are not doing the basically are not doing you any services. When it comes to the templates, the management tools that you will help that you will have to help you along this way, the first thing to know is that you will have prepared them in advance, as Stefan has mentioned. You will have them in your protocol. You have to make sure that they are very accessible, that they're used by your team members, and you should explain to your team members the need for these templates. So the need for a standardized format of recording progress. And also you should reiterate the importance of adhering to these templates, especially if your team members are not sufficiently adhering to them, which means that you have to periodically check if they are in fact using this template. Which should be, yes, made available. When it comes to record-keeping practices, here we have an example of the record-keeping practices that we had for one-on-one consultation type services, which was developing a template for reporting on service provision. Our pro tip would be to make it a table so that the reports are standardized, right, and easily comparable. What we said, and this should also allow you to track any relevant variables. So it's important to think through the format. Here, you can see the example of the template that we used for reporting on service provision. So basically, you can have codes. Here you have the beneficiary code, but also if depending on how your service is designed, you can also have codes for the topics and things like that. Obviously, you can add to this template. You can maybe detract something from it if you don't think it's necessary. Here we try to sort of have a balance between the length of the template and the details that it offers. Which brings me to my next point, which is the coding system for tracking service provision. It's needed in order to maintain anonymity if the service design calls for it, or if the service design allows it. In a moment, we will say more about when the service design does not allow it. But for the purpose of this example, you should have a code assignment system, which should be explained in the protocol. I mean, it absolutely has to be explained in a protocol. And also in the protocol, you should provide a randomly generated example of this coding, of a code using this system, right? And this code should provide basic information on the beneficiary and situation. This basic information does not have to include any personal detail. It can include just the ordinal number of the session. It can include the gender, age of participants, if they are comfortable with sharing this. So this can be a very rudimentary way to track, to actually code your service provision. But the million-dollar question is, what do we do when by service design, the services cannot be provided anonymously? And because ReGeneration does not have any experience on this topic, I will now give the floor to Lella Cosmaro from LILA Milano, who will tell us more about this topic. So about the management of provision of services which cannot be anonymous.
Thank you, Nina, and hello to all. As you probably remember, last time I introduced some digital tools and digital services on the prevention and testing, treatment of HIV, hepatitis, and STIs. And today I will take a little bit more time to talk about digital services that cannot be anonymous. I thank Nina and Stefan, because they explained a lot of things that we do also at my organizations and in general in Italian organizations. Because we always run a lot of mostly anonymous services, but there are some services sometimes that we are asked to develop and implement that imply the collection of personal and sensitive data that cannot be offered without acquiring and collecting personal and sensitive data. So we prefer, and probably our clients in most cases prefer, to remain anonymous, but if they ask something specific that implies it, we need to be prepared to protect their privacy if they have to give their personal data. So I'll briefly explain how we are doing this. And to start with, I need to say that the first important thing is linked to the reliability of our organizations, or the organizations we are working in, either at local or national level, depending on the reach of our services. And LILA, my organization, for instance, is a very well-known NGO in the country. It was founded in the late 80s, and therefore, I mean, it has a lot of experience and has always been at the forefront for the defense of the rights of vulnerable groups and advocacy on the right to health and access to health services, offering legal support to vulnerable people with a harm reduction approach. And this is acknowledged, and therefore people trust our staff and the attention that we devote to taking care of their needs. So this is a good presentation that we can offer our clients, the beneficiaries of our organizations, when we want to, when we need to ask them for their personal information. So after having said this, I will go back to the teleprep service that I briefly talked about in the previous training last week. Teleprep is a remote service for people who live far from infectious disease hospitals or far away from even checkpoints. And I'm sorry, I'm losing my voice, and who therefore cannot physically access the PrEP services. And this totally online service implies the exchange of personal information and health records. So the HIV test results, blood test results, PrEP prescriptions, etc. So it is presently founded by a pharma company and was started at the beginning of 2023. So it's not even 1 year and a half that we have implemented this service. And we have acquired a certain experience now in handling it. It's a little bit cumbersome and requires a lot of steps to ensure privacy and protection. I will try to explain how it works. So when people get to know about this service, the teleprep, they usually come and visit our website, lilamilano.it, and they book a remote Zoom appointment online to get some more information. They can easily do that. Last time we showed a little bit how the appointment tools work. We were looking at a couple of them, and we were also introduced to the future appointment tool prepared by the Cobates team. Now I'm referring to the appointment tool that we have on our website of Lilla Milano. So they use the appointment tool, they choose a date and time, and they include a name that can be different from their official name, registered name. If they do not want to disclose their identity at this stage, and they have to include an email address, which could be different from the official one that shows maybe their actual name, last name. It could be a fantasy email address. So they book with their name, maybe fake name, and an email. When we receive this communication of their booking, we send them an email enclosing a very comprehensive document on the treatment of their data. It is the document that you will never be able to read or understand that is showed in this slide. I'm just showing it because you can see that it is a very detailed and comprehensive document, which is necessary for us to start the relationship with those people who then will become the clients of the teleprep service. In this document, we explain that to offer this service, we need to access their personal information and we need to exchange health records. We detail very detailed how their data are treated, and we ask them to sign the document for acceptance and send it back to us. This is mandatory, otherwise we cannot deliver the service. We need them to accept the privacy and to understand how we treat their data. A very small percentage of people, to be clear, who booked the first appointment does not send back the privacy document. Maybe they understand that it will be necessary to share the data and they don't want to make this step. So they won't be counted as clients of the service, of course, they are dropped and the relationship with them stops there. Those who send back the document instead receive the Zoom link for the appointment that they have booked online, and they can have the first online conversation with the teleprep staff, the peers. They are given detailed information about prep on the online service, and our staff assess their willingness to start prep and collect info on their sexual behaviors. We have to collect info on their sexual behaviors and sexual partners. If they have previous STIs, we have to function as a normal, let's say, face-to-face prep service. So we are asking very sensitive information online, and we have to assess their willingness to start prep. And at the end of these conversations, if the clients maintain the will to start prep, they receive via email, the same email that they have used the first time that they contact us, the list of tests that they have to take before the appointment with the infectious disease doctor. You can go, you're right, Nina, you can go to the next slide. Okay. They will have to send us the results of the tests, of the blood test via email. So they will have to somehow make a PDF or digitalize their results and send them to us. And these tests also include include a very recent HIV test that they have to take right before PrEP starting PrEP. So they will also disclose the HIV status to us. And after receipt of the test results, they receive a Zoom link for the appointment with the PrEP specialist, who has a more general conversation about their health conditions and PrEP attitude. And at the end of the conversation, the doctor prescribes PrEP. He sends an electronic prescription via email to clients. And so this is the first part. They start PrEP. And after 1 month, after starting treatment, they are contacted again for a subsequent HIV test. We need to be sure that they are still, because of the window period, HIV negative. And then every 3 months, they are reminded to take follow-up tests for STIs and other blood tests to check their renal functions and other health issues. And these exchange of personal tests, results, and prescriptions go on and on. We have, of course, a database to record the deadlines for quarterly follow-up, and they stay connected to us through calls, through chat, conversations with the peers to assess their adherence to PrEP and the changes in their sexual habits, improvements or changes, and with the doctors to monitor their health conditions. So, this is very briefly how this service works. So as you can imagine, a lot of personal data is exchanged, and how can we ensure the privacy? So briefly, of course, our website complies with the GDPR regulation, and the website clearly reports the policy on privacy. This is what you see here. This section of the website, they explain to people how we treat the data and how the privacy is protected. All of our staff have received the training on GDPR guidelines, both for treatment of data online, but as well for handling of personal records in the premises, because we have other services that imply exchange of documents also face-to-face. This means that we have a person specifically in charge to supervise adherence to the GDPR regulations as per the Italian regulations and European regulations. And for online security, as per the present regulations, our PC and laptops are protected by a password, which is strictly personal and changed every month. And our screensavers have a timeout of 5 minutes, and are likewise protected by a password so that people cannot access the devices when staff leave their work stations. And the cloud where the records of teleprep clients are stored is protected by a password that is known only by the 2 teleprep staff and the doctor. So all the records and the data are protected, and this is explained quite openly at the beginning of the relationship with the clients. And we, again, even in the first conversation, explain step by step how we protect their data, and if they are comfortable to proceed in this relationship with our staff and with our organization for offering the service. So this is very briefly what is happening. And I hope it was clear enough. And of course, I am open to any question that you might have. I would have other examples, but I think for this session, I stop here. And maybe I'll make other examples in the next 2 training sessions. Thank you.
Thank you, Lella. Okay. So the last part of my session today is related to the evaluation of digital services. Evaluation is a process which takes place after the completion of service implementation, but partially utilizing the insights and the data collected through management and monitoring, obviously. For best results, in our own experience, you should employ sort of a double evaluation, because on the one hand, you should collect feedback from beneficiaries, and also on the other hand, you should collect feedback from the service design and provision team in order to have just multiple perspectives, because these two different groups of people will be able to provide different insights or insights about different aspects of service provision, which both affect the process of service provision. It's good to use a questionnaire form with both closed-ended and open-ended questions. This particularly is this particularly is important when asking for beneficiaries' feedback. You will create, this is an example of an evaluation template. Obviously, the evaluation will be on a platform in the form of, well, a form, right? So it will not look like this, but this is the layout of the questions, and this is just an example. This was for our video conference one-on-one consultation services. Obviously, this template can be just an inspiration. You may want to shorten it. You may want to maybe add some questions. Some questions may change depending on your service. What's important to note is that you should use the logic of the form to your advantage. So, for example, everywhere where it says, if the answer to previous question was this, that question will not be visible to everyone, but just those who gave the appropriate answer in the last question. You can sort of use the logic of the questionnaire when you are creating the form on the platform that you're going to use it. And you can also obviously create a similar form for the service team, asking them to estimate these aspects of service provision or provide recommendations for improvement. You can also talk to your team personally. You can use both approaches. It really depends on what you prefer, on what you think would give you better results, etc. A pro tip is to explicitly ask for suggestions for improvement, because you can get very, very good recommendations this way. These are just some examples of the questions, like if you could change something, what would it be? Or what would you add? Or what would you recommend to our service providers? So that can be anything. And you can get really, really good feedback from this. But also try to keep it short and sweet in terms of no one is going to answer like 25 questions in an evaluation form, especially not beneficiaries who are just given the link at the end of the session. And also, it's important to note why we need the evaluation of services. The purpose of the evaluation is to make an estimate regarding the service and its effectiveness. And the ultimate goal is to actually turn this feedback into recommendations and strategic efforts to improve the services in the long run. So if we compare the process of monitoring services and the process of the evaluation of services, we can see that monitoring is designed to actually catch some bigger issues. It paints with broad strokes, and it essentially searches for problems. Whereas evaluation is designed to sort of sift through the minutiae of service provision and just actively seeking out room for improvement. So any minor bugs you see will be you will just file away, and they will be addressed in the evaluation phase, not in the monitoring and management phase. Also, monitoring identifies larger issues, and it offers an opportunity to troubleshoot, to adapt as you go, to make necessary adjustments, mid-service, whereas evaluation provides a more detailed approach, a more comprehensive approach, an overview of the service, and it helps you improve it in the next cycle, or when you are providing your next services, when you're designing your next batch of digital services. And I'm sorry, this was the last for me. So I will now stop screen sharing and see if there are any questions. Yes, this was okay. I know that time-wise we had a couple of issues. I'm sorry.
Right on time, right on the schedule. So yes, as we previously announced, thank you, Nina, and thank you, Lella. I think this was super useful in comparing the anonymous versus non-anonymous services, because these two offer very different views of how people are approaching and what do we need in terms of resources as well. So, and in terms of managing the services, I know that our anonymous services are usually much lighter burden to the team, being that we do not need to take as much steps into planning of the service and planning of the data management, because we choose what to manage in regards to data. And this is why this is a little bit different and a little bit easier. So I think that when you're thinking about the service and designing the service, this is also something you think about when planning the resources, because if you do collect personal data, especially the doctor's exams or blood tests or any health related data from the people, including their personal data, there is much more resources you will need to manage the service and also keeping everything in place. So I think this is something that ReGeneration as a community-based organization didn't have as much of the resources. So this is why decision went to having service being anonymous, but still being there for their community. So in that sense, this is something critical thinking that needs to happen prior or in planning stage in order for you to be on point with the service if you're planning such. So yeah, right now, question and answers. So please come in with any question or an answer. You can anonymously, or at least to me, I will keep your data if you anonymously send questions only to me, if you don't want to send it in the chat. So we can also try a little bit how this works. And I'm promising within this community that I will keep the person only to myself. So I guess that this is also very, very much management and planning information that you heard in just 2 hours. So in the sense, it can be overburdening, but I feel it was step-by-step guide through how do you manage and plan and implement and evaluate the service. So in a sense, it will be maybe also useful to return back to YouTube and also to the manual when we have one, in order to kind of figure out for yourselves, and also among the team, as Stefan was previously mentioned, this cannot be work from just 2 persons or 1 person. The decision, it needs to happen in a team, and it needs to happen also taking into account community. So also, and going back and forth between the team and community, or the service provider and a community if you're not community-based or community-led. So also, it is a lot of back and forth planning and implementing in order to secure that something is running. But even then, things can happen, and then tools can happen, tools can change, regulations can change, privacy issues can arise. For example, we are all aware that Facebook is, for example, changing the privacy statements all the time, but then we're not so, like, usually people are just agree with everything. Yes, do you agree? Most of us are just clicking, yes, I agree, and this is it. So when you're delivering a service, especially for us, that was important during the Zoom sessions, yes, I agree was the thing that we could not just do. We needed to take care about every single thing that says when the privacy regulations are changing. In a sense, with the Zoom, I can say from the experience, they started using all of the AI options and artificial intelligence data collection for improvement of the service and the platform. But in a way, we had a huge discussion about should we add that, or should we add AI into the sessions we are having with our clients. And decision was made that we're not using that, just because the AI is collecting data that we're not even aware of. So it can collect also IP address of the person who is on another side who wanted to stay anonymous, but we couldn't secure if that will be completely true if we're not even sure what the AI Zoom is actually doing. So always is, when planning the service, I think the always good is to also read the protocols and what you are agreeing on when deciding on a platform, but also consult maybe somebody if you have resources for such a consultation, for to be sure that you're delivering also honest information to your clients, that they're going to be safe and secure, the data is going to be safe and secure, and so on. So I'm going to ask you for your questions, and I'm going to share the evaluation form for you. Just a second, I'm doing many things in one. So in the chat, I shared the evaluation report from this session. So please fill it in with the marking the second session. So it was the training 2 or session 2, planning and management of the services. I think this is how it's called in the form. So I will be happy if you fill it in if you don't have questions, but also if you do have questions, we're still here for a couple more minutes. And we're going to make sure to follow up also with the follow-up email, and also provide your registration links if you have not registered yet, with the registration links for the next two sessions. So as announced, the next 2 sessions will be specifically on tools. That is going to be held by our colleague Alexei Lachov next week, and maybe some guests. And in the session 4, it will be our colleague Adria Quesada, that you might know from the previous session, and he will give us in a little bit deeper insight on GDPR and safety protocols and data safety, and we will have some group divisions where you're going to be able to choose which specific topic you want to hear about for, I think, half an hour. So it will be a little bit more dynamic, but also we're going to keep with a schedule to meet every Wednesday from 4 to 6:30 Central European time.